Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Every person's spine curves to some degree, but for some people, that curve becomes too prominent and they develop a condition called scoliosis. Here to talk about symptoms and treatment is Dr. Greg Mundis. He's an orthopedic spine surgeon who specializes in scoliosis. He's with the Scripps Clinic Medical Group in La Jolla, California. Dr. Mundis, thanks so much for being with us.
Thank you so much for having me.
So, who is at risk for scoliosis?
So we see two groups of people develop scoliosis. One is the younger group, usually teenagers or even younger, where they develop it during their growing years. The second group that we see affected by this are adults, usually in their 40s, 50s, or 60s, where it just kind of shows up, sometimes quite randomly.
And what causes it?
Well, the causes of scoliosis can be twofold. In the kids, we likely think it's more of a genetic cause, where as the child is growing, for whatever reason, their expression of their genes that they're born with leads them to have a curved spine. Now, in the adult, things are a little bit different, because what usually happens is that as we age, arthritis sort of sets in, and you can get this degenerative cascade where the joints in the spine actually deteriorate, the discs kind of collapse, and when they collapse that way, you can get a curvature of the spine that we call scoliosis.
And what about tumors or infections or accidents? Can that cause scoliosis as well?
Sure. As you can imagine, if you have a tumor in one area that's causing the spine to twist, or maybe an infection that gets into the disc or the bone, it can cause a collapse that leads to the spine to actually curve. Other things, like you said, getting into a car wreck and breaking your bone can all lead to deformation of the normal spine, which is supposed to be straight, but then ends up being curved.
And then what are the symptoms?
So ironically, in kids, there's usually no symptoms. It's usually picked up by, them looking in the mirror and feeling that things are just a little bit off. In adults, it's usually pain that leads them to seek help.
And how is it diagnosed?
So diagnosis happens in one of two ways. The first one is clinical. In other words, we like to see our patients in person and evaluate their spines. When you lean forward, we can actually see the tilt in your back and then measure the scoliosis with something called a scoliometer. And this degree of curvature then prompts us to use the second way that we diagnose it, which is an X-ray. Now, this is a traditional X-ray that we typically use to diagnose it, but at Scripps, we now have access to a state-of-the-art new X-ray machine that allows us to take these X-rays at a fraction of the radiation dose, but also to evaluate the spine as it relates to the entire body. We can measure the degree of curvature and where it's located, and then be able to more appropriately recommend management.
So is there a way to prevent scoliosis, or is there a way to slow it down?
In kids, we do know that the use of some brace wear, especially when the degree of the scoliosis is a little bit smaller, can actually help the scoliosis from getting worse. In adults, we're on a different cascade, because it's the spine that's degenerating that is leading to the problem. So anything that we can do to promote our spine health will hopefully stop that progression from happening. Having a curve is actually quite normal as we age. And so what you want to do is keep the pain at a minimum. And that's the type of progression that we would like to prevent.
So how do you treat scoliosis?
Well, the way we treat scoliosis in kids differs actually than we treat it in adults. In kids, while they're still growing, we have the opportunity to use a brace that can actually help the spine straighten as the child is growing. In adults, we're done growing, so it doesn't work the same way. So brace wear actually doesn't help very much. We try all kinds of non-surgical management, however, for patients that have scoliosis-related pain. And that can include things like chiropractic care or acupuncture or physical therapy, all which can be effective in trying to help and promote the pain reduction. If you're having symptoms that are going into the legs, like nerve pain or sciatica, oftentimes we'll use nerve blocks or epidural injections to try to help with the pain that's associated with the nerves. And when all these things don't work, sometimes we have to use surgery to help the problem.
And how quickly do patients recover from this surgery?
It really is dependent on how big the surgery needs to be. There's less invasive surgery, minimally invasive surgery that sometimes is applicable in these cases. Sometimes patients need a bigger operation to straighten out the spine. So recovery can range anywhere from a couple weeks to several months, even up to 6 months.
How do you know that you're at the point when you should go see a doctor about this?
So the way I like to talk to my patients is to kind of think of in terms that make sense. So think about a 7-day week. If you are plagued by pain for more than 4 days a week, that tells me that your back is really limiting you more times than it's not. So that's a good time to go seek help. Certainly, if you have symptoms of like shooting pains down your legs or sciatica or other nerve type of pinching, then you want to be evaluated for that as well, because there could be other reasons for that to be happening. But certainly, if pain is becoming a factor in your quality of life, then I would definitely recommend seeing someone for some help.
Any final thoughts, doctor?
Sure. I think a lot of patients feel a lot of anxiety around their spine, especially if they're having pain in their back or pain in their chest that's coming from the spine from scoliosis. I just like to encourage you to take ownership of your back, exercise, eat well, stay healthy, because the chances are if you really take care of your body, then you won't need anything that's more aggressive as far as treatment, and you'll be able to get through life, hopefully in a relatively pain-free fashion.
Dr. Mundis, thanks so much for being with us. We really appreciate it.
Pleasure's all mine.
If you want more information on scoliosis, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.